what I'm here today live for is the running theme workshop that we have. We're doing our virtual workshops with the Protect Your Back Before You Wreck Your Back series. And I want to chime in and discuss a lot in detail about what running mechanics is about, what kind of injuries that would happen, how we break down the areas that are potentially injured and how we treat it. And so I would like to share a presentation, and there I'm going to go into some specific details as we go along, but chime in, jump on either the Facebook Live to tell me about any of the questions that you have, or on this Zoom call, and you can I can answer the questions as you post it. This is who we are. We're the owners of Personalized Physical Therapy and Wellness. On the leftmost, that's me working with one of our fan people, as well as on the right, that's Farheen, and she's actually doing a balance screen on a workshop that we did not too long ago, before all of this started closing down. And then in the middle, I have that picture knowing that we now are servicing people with the telehealth service. So basically, telehealth is something that we take care of people virtually. We help them through looking at their positions, their postures, their exams, all of that, all through the computer, one-on-one personalized care. And then we take it to the next level by designing personalized program, walking them through, and then providing them programming with exercises and all. So what we want to talk about today is the running theme of protecting your back. But I'm not going to only talk about the back. I'm going to talk about the whole mechanics, the mechanics of where the foot lands, and how the foot lands, and how the knee mechanics come into play, and how the lower back and the hips come into play. And we're going to break down each and every movement one by one as we move on. And so here's the agenda for the day. We're going to look at biomechanics of the walking and running, and we're actually going to break down the walking and running into two parts as to the differences between walking and running, and the secret formula to lasting any length of a walk or any length of a run. The 6 determinants of gait. Gait is just a fancy term for walking. And running injury causes. How does a running injury occur? What kind of factors are involved? Primarily, there are 2 factors, intrinsic and extrinsic, and we're going to dig down deeper into those. And then how to prevent that, and type of stretches and strengthening that you may potentially choose to do on the muscle groups that you would want to do that. Looks like Michael Ross Gordon has just joined us on Facebook also. Hey, Michael, thanks for watching. Hey, Forum's watching from New York. Hey, Forum, just comment live right at the bottom and say how are you guys doing. It's been great seeing you guys. It's been a little while seeing you. Rakshanda has joined. Welcome. All right, so biomechanics of gait running. So we're gonna dig into the biomechanics, but before we do that, we want to look at the anatomy. Let's look at the foot anatomy and the areas that are involved in how it plants and how it moves forward as you run. And so the role of the foot motion, there are different types of joints in and around the foot. The first joint that we can talk about is the ankle. So the ankle is right here, right above the pink square is the ankle joint. And ankle joint has the dorsiflexion and plantarflexion, which is the gas pedal push motion, and then the pull up motion. But along with that, it also has another triplanar motion joint available called the subtalar joint. And subtalar joint has inversion and eversion available, as well as it has the abduction and adduction available, which is like turning the foot inwards and outwards, and inversion. Inversion and eversion is this, and abduction, adduction is this motion. So how does it help? It helps in force dissipation. The more motion that you have, it allows for kind of absorbing the force as the forces travel up the chain. It provides as a mobile adapter. If it was a rigid unit, then it would get a lot of force into the joint, but it has a lot of independent small joints, so it kind of absorbs a lot of force, and it provides a rigid lever for propulsion. But along with having all those joints, we have such a nice mechanics underneath. We've got sling muscles sort of going below the foot, around this area, where there is lumbricals, the peroneal muscles, the plantar fascia, all of that kind of creates that dome effect and that sling effect that creates that rigid lever as you move forward into the propulsion. So looking at some biomechanics of running, differences of running over walking, and we will go into the differences a little bit later, but right now we're going to talk about like the velocity. There is obviously in running, there's greater change in the velocity with running, the speed versus the walking. The movement is a lot more. There's a lot of energy costs, generally higher when you're running. You're spending a lot of energy. And then there are obvious phasic differences. And what are phasic differences? We're going to dig in a little bit more as we go along into our presentation. But there are 6 determinants of gait. So there are 6 specific areas that determine how a walk or a run happens. One is the ankle, which is the ankle which we went over, the knee ankle foot interaction, how they interact with each other, the pelvic rotation, the transverse plane, your hips, how are the hips moving, the lateral pelvic tilt, the frontal plane alignment as to when you're looking at yourself. And you're gonna go into some pictures later on as to see how the alignment changes, and if there are different, what can happen accordingly. Looking at the knee flexion during stance, that's a big one. The amount of knee bending that you may be having or not having. If you're keeping the knee too straight or too bent, that can result into specific changes. And I'm sure Jane can talk about a little bit more on the knee flexion changes, because I feel that your issues on the knee comes from there, and we'll talk about it in detail when we get on our session. But gait width, which is the length, the stride length that you take from one foot to the next, is something that is what we dig into deeper. Oh, Helen has joined. Hey, Helen, welcome. So, all right, so digging into the secret formula to lasting any length of a walk or a run. So these are the specific things are needed based on physics. What is energy expenditure? Energy expenditure is the amount of work done. Now, the amount of work done is the force into distance. So the force that you are developing by the body mass and the speed, and the amount of distance that you're going to go is equal to the amount of energy that you're going to spend. So if you can work on the amount of body mass, the speed, if you can change any of these, so if you can alter the amount of body mass, the acceleration, which is the speed, or the distance, then you can work on either lengthening or sustaining the speed or the force or the acceleration of your walk or a run. And so these are the variables that as a physical therapist we would look into and dig into as to, okay, what's happening? Are you able to last your run? What's happening? Is it because of pain? Is it because of not enough strength? Is it because of endurance? And we look at all of these mechanics into apply these formula into how we can increase your length of run. But that's very superficial side on the physics side, but let's go deeper into the body movement. So let's look at the walk first and then go into the run. So earlier I mentioned about the 2 different phases of your walk, which is there are there are 2 different phases of the walking and running. Okay, so the walk, there's basically, I'm going to go to the next slide because it'll make better sense here. There are 2 phases. One is the stance phase, and the other one is the swing phase. And so what is the stance phase? The stance phase is when you plant the foot is already planted, the heel is planted, and then from the time when the heel is planted to the time that you then all the way walk off the toe, which is, you can see The first picture right here is the foot contact and the toe off. And that's about 60% of the time that you spend in a gait cycle. And then comes the swing phase. So once the toe is off and then you're swinging, 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 and boom, comes the foot contact again. And that's about the 40% of the swing phase. So that's the walking. Let's pause for a second and ask on Facebook and on Zoom, is everything okay? Do you have any questions as I am moving? I know I'm moving fast and I've got a few slides to cover, but questions, anybody, let me know. Just maybe if it makes sense, just comment makes sense. Just kind of put makes sense. So it makes sense to me that it makes sense to you. But moving on, we're looking at the running mechanics. And so in the running mechanics, you are digging into, again, two different phases. One is the support phase, and the other is the recovery phase. And so what you see in the support phase is that foot stands and that toe off, yes. But there's also a dynamic movement phase in the middle, right from this side, this point to this point, and that's called the never a double support, or rather I should say the double support phase. The double support phase, this guy right there. And so actually I'm mixing things up. So on the running, it's actually the flight phase, not the double support is the walking, and the flight phase is basically you're up in the air. You never have 2 feet in contact when you're running, and that's the difference on running and walking. And so walking has the double support phase, and the running does not have the double support phase. Moving into the running joint range of motion adaptations, what is required at individual segments for running? Obviously with the ankle, there's, all of it is going to be increased. At ankle, there's more range of motion, basically plantar flexion, dorsiflexion, pronation, supination. There's more increased flexion in early stance and swing. There's more flexion and extension with hip. There's more transverse plane rotation of your pelvis. There's more range of motion on your shoulder and elbows. So all of it is you need more of. And so how is the propulsion produced? And the propulsive force, just like, again, laws of physics, the Newton's law, third law of physics, action and reaction are equal and opposite. You need to be able to push against a surface to be able to create a reaction force for you to propel forward. So the surface is also very important. And in these instances, as we talk about, and we're going to dig into how the surface can play a role into your injuries, where you're running on. And then the transfer of momentum. So you got free legs and free arms moving into it, but you've got an axial skeleton that is standing tall, and you got to control it as you run. And so it's important that we know how we're transferring the momentum and how you're creating the propulsive force, the momentum, the moving forward force. How is the momentum dissipated? So the momentum is the actual generation of your mass, the body mass, and the speed that combines together results into a force, a momentum that kind of is transferred onto the surface, onto the floor. And these are the mechanisms that you see that might be necessary to look into when you are evaluating running mechanics. And so this is something that we would do in a running evaluation for an athlete as to what is going on when you actually plant the foot on the ground, like looking at the foot, looking at the ankle joint, looking at the knee joint, looking at the actual shoe and the surface. So these are how the momentum is dissipated at these areas. These are the structures that allow you to absorb the force. And so how is the forces absorbed? This is a graph. And again, I'll pause for a second. Guys, let me know if you have any questions. I am gonna make sure that you guys understand the concepts well. And I think, a lot of times what I notice is that there are, 5 best exercises and 3 best exercises for one or the other. And those are great and well and helpful. but quite often we don't really dig into why would that exercise be important and how it will affect your running mechanics. And so this is what I'm going into, digging deeper as to the education piece of what is the running mechanics involved, the biomechanics part, and as well as what kind of movements you would necessarily need based on the examination that we would do. But here's the difference. So what you're looking on the y-axis is the Newton per kilogram body mass. Simple words, the amount of force that is being put on the legs, on the body itself, versus the force put onto the body when you're walking. So running versus walking. And so basically you can see that there is more force in running and less force in walking. And so there's 25 to 30 newtons, and 1 newton to pound is like 0.22 pounds. So about 25 would be about like 10, a little less than 10 pounds of force when you're calculating in a 0.2 second time frame. So it actually builds up, and the next slide we go into, we'll look at amount of force that you actually pound onto the body when you're running versus walking. So ground reaction forces in running, what all things are required for the ground reaction force. So ground reaction force is, as we mentioned earlier, the action and reaction are equal and opposite in the Newton's law. So the action part is when you're running onto the surface, and the reaction part is what the surface is giving back into the joint, into the foot, allowing the body to take off again. Because think of if the ground wasn't solid and there was no reaction back, if it was, let's say, water, you're going to just sink in. So there is basically no ground reaction force out of water. There is some, but not a whole lot. And then you're just going to sink in versus a hard surface. So you have a reactive force coming out into the body, allowing you to propel forward. And so that ground reaction force is influenced by the velocity, the speed that you hit the ground, the vertical displacement, the amount of height that you pick up and come down onto, the shoes, obviously, the cushion, and the surface, what surface you are on is going to decide the ground reaction force generated off of. And the influence. And the influence is the foot pressure. So how we can make changes to the ground reaction force. So we can make changes to the amount of foot pressure that we put, the joint forces, the individual joint segments that we went into earlier, forces, the joint moments. The joint moments are like the smaller tweaks and positioning and movements that happens in the joint, as well as the impact shock. So that all influences the ground reaction force. And this is the braking, propelling, ground reaction force pattern in running. So this is what I was talking about. We're going to go into deeper later in the graph. This is the graph I was talking about. So this is the Newton force, right? So this is the amount of force that acts onto the body in running. And so this is the negative and this is the positive. So the negative is the amount of force that the body, when it hits the ground, has to stop, like almost control the body back into rhythm before it shoots back into the next step of your run. And so the braking, so when you're hitting the ground, you're having to bring control back, and there you're losing about 200 to 400 newtons, which is equal to about 80 pounds. So about a little less than 80 pounds, but about 80 pounds of force. So let's say you weigh about 150 pounds, and that's how I calculated off of 100. Let's say you weigh 150 pounds, that about 80 pounds of force you have to negate and then come back to neutral, and then you push another 80 pounds back up to continue to keep that momentum going. So there's a normal pattern of braking and propelling as you're running. And that's how like all these forces are impacted. And this is the medial lateral. So the anteroposterior, so this was anterior posterior, meaning you're going forward, and the force that kind of puts you going forward and the force that stops you coming, but there are also forces that kind of tilts you one way and that tilts you the other way, because you got two legs and you're like on one leg and then you're on the other, so you're kind of going left, right. So this is the left and right changes that happen. So about 100 pounds of negative force, and then another about 80 pounds of 100 newtons, which is about 20 pounds, and 20 pounds of force going left and right, kind of shifting back and forth as you are running. So, changes happens in that. But running shoes issues. So then now, as we discussed about the mechanics, we kind of go into some issues that you may run into in the running shoes. You just want to make sure that you have the right amount of cushion. And for running shoes, I would start at analyzing your foot first, and then kind of looking at how is your mobility in the foot, what kind of congruency, what kind of positioning. And maybe as I'm talking about the foot, we should move into the slide that I probably should have kept it in this section, which is the amount of angulation on the foot that you have. And I'm going to glance over to Facebook real quick and see who's all watching. Hey, Susan's watching. Hi, Susan. Umang. Hi, Umang. Raj. Michael. Forum. Nashina. Thank you all. Thank you for watching. All right. So going into the foot. So I would start at the foot mechanics before going into the shoe. And so looking at what kind of foot mechanics do you have right now, and this is an example of a excessive pronated foot. So what you notice is there's extremely flat foot during the weight bearing, not a lot of arch you see, and then a medial whip. So that's like your heel basically has a tendency to just come in. Every time you leave, you're like turning the foot like that, instead of just a normal foot forward motion. You're just kind of twisting like that. Abducted forefoot, your foot always points outward rather than forward. Bunions or calluses, you may develop bunions and calluses when you have pronated foot. Medial shoe wear, the shoes on the inside half is going to wear out earlier. Longer leg, you will have longer leg because when you pronate, then you automatically create leg length discrepancy that affects the back. And then the footprints in the sand. So, basically that's one of the ways that you go to a shoe store and get the foot posture examined, is when you plant on, you kind of look at the footprint. And the other one, which is important to also dig into, is the supination. The supination is just the opposite of pronation, which is you have excessively high arch and weight bearing and increased lateral wear on the shoe and the shorter leg. So you have shorter leg, lateral wear. And so accordingly, I would decide what kind of shoe would go, what mechanics are required for the foot, and what do we need to counter when we are hitting that ground with that 80 pounds of force every time you're doing the pounding. Your important is like what surfaces you choose to run on, and that's where the shoe will come into play. So it varies based on your foot mechanics, but overall, if you have pronated feet, then you want something that has stronger, higher arches. And if you have supinated feet, you want something that is soft and cushy, as well as that it gives in and it has a bigger, thicker base that allows you to have that compressive effect and doesn't cause a lot of pounding in the body. Moving into the energy cost. So surface shoe cushioning versus the energy cost. So that cushioning also plays a role as to how your energy cost is going to be, which is basically the softer the shoe that you're going to give in more, so you're going to lose energy. And so your energy cost is going to be more, and the firmer the shoe, the lesser energy. But again, all of this has to be looked at in a respect to how your foot is then, how is your knee, how's your back, how stable the chain up the body is, to decide what is the best way. And so that's the mechanics that you go into when you're evaluating, when we evaluate you on either a treadmill or just running mechanics, just doing some videos. What factors influence the speed? And so speed, again, a formula, basically you're talking about stride length and stride rate. And so the stride length, the longer the leg, the anatomy, the higher the strength, the more the flexibility, and the more control. Neuromuscular factors are like the more control you have, more length you have, the better the speed, as well as the stride rate, how fast you can create those strides, and the control during that time, as well as the technique, is equal to the speed. So that's how can the running speed be improved. Yep, you have so many factors to work on. If we can work on even one, you will see an increase in speed. So think about if you've gotten a slower speed, or if you have hurting or whatever, all these are the opportunities and potential for us to dig in and create more speed and more mobility to allow for more better performance. But biomechanics of running issues. So what all areas we go in, when do we end up with issues? When there are issues with speed, vertical displacement, extra motion. If you're ending up having extra motion around the foot, knee, hip, and optimum stride length stride rate relationship, as we just talked about. And can the running efficiency be improved? Of course, yes. We can kind of look at where can we take away the energy that is being dissipated, and where can we give in more energy that can be added to allow for increasing the efficiency of the individual segments, as we have just discussed about earlier. These are the injuries that you see, and this is off of a study that was done at St. Elizabeth's Hospital series, 974 runners, and primarily knee pain. Knee pain was among the number one, 30.5% injuries in the knee. Heel spur syndrome, 13.5. And then as you see, all of these are listed as you go along. And out of the knee, the highest one was the peripatellar pain around the patella, or the lateral knee pain on the outside of the knee. And so most running injuries have biomechanical origin. And whatever we've just talked about so far, all of it is biomechanics. That's what we're digging into right now, is most running injuries have biomechanical issue. And most of the time, it's either the issue with the force, issue with inability to dissipate the force, or the repetition and too much of running. So a combination of all, we kind of dig into that during our evaluation. But running injuries, contributing risk factors. So this is what we wanted to dig in when I talked about running injuries and the two basic types of factors that are involved and necessary to know about when you are diagnosing the injuries. And so let's go into the extrinsic factors first. So extrinsic, as the name suggests, it's external to the body. It is something that you can make changes to yourself, not a big scheme of things. You just need to have the knowledge and understanding of how you can do that. It's just training errors. So if you've been training too long, too much, too hard, too many times, then you kind of address that. Equipment, like what kind of equipment would you use if you're running on a treadmill, if you're running on a ground surface, the surface that you may be running on, like is it hard, pavement, stuff like that. Environment is temperatures, the weather, the temperature, the humidity, the pressure. Sports imposed deficiencies based on the sports. Like sometimes we get too rigorous about one particular exercise, one particular routine, and one particular sport that creates patterns. And the body is a 360-degree movement body, and so you want the 360-degree to be helping you move the body in different segments. So cross training is important during the sports imposed deficiencies. And then technique and biomechanics, and the type of technique and the biomechanics that you have. And that is a very easy transition to the intrinsic contributing risk factors, which is the biomechanical abnormalities and malalignment. So the alignment of the foot, the knee, the hip, the lower back, the mid back, how is it all aligned? The biomechanical abnormalities. This reminds me of one of my tennis players who had some malalignment, and we looked at the mechanics, and we looked at him, how he was squatting and how he was lunging, and easily it was appreciable that his knee was falling in too close and the foot was going in too far. And we had to even talk to him about his shoes, and see, about 2 to 3 visits in, his pain started to go away, and 6 to 8 weeks in, he was back to playing tennis 5 times a week. And he had injured himself by landing. And so again, so important to talk about the landing mechanics into the running also, because it's the same body, and that landing, the physics formula doesn't change. The mass into acceleration, the mass is the same, and the acceleration, the speed is the is that kind of varies. But if we can change that, as well as the factors that causes to dissipate the force, then we can make changes happen. So biomechanical abnormalities and malalignment, muscle imbalances. Quite often you see, again, similar in the gentleman that I'm talking about, tightness on one side, weakness on the other side, and increased tone on one side, decreased tone on the other side, exercising too much one way, not exercising the other way, stretching one way more, not stretching the other way, lack of flexibility, which all we talked about, muscle weakness, same thing, instability. Instability is very common. So there are kind of two types of instability: passive instability and active instability. And passive is like at the ligamentous level, like you sort of born with it, and you have to like come up with strategies and practices in your life that would allow you to counter all of these instability that might your body provides. But at the same time, that your active instability is when your muscles and your joints sort of are out of alignment, and one is a longer leg or a shorter leg or weaker, and that creates instability as you're running. But let's look into the specific issues with running that we walk into and we treat daily. So all these three pictures. Let me ask. Can you guys think or tell me what might be the potential running issue each of these athletes are moving into? What do you see the pattern?
Well, the middle one, her foot is definitely pronating out, and so her knees turned out, and so it definitely, you can tell that she's putting a lot of stress out in that direction.
Absolutely, absolutely, perfectly picked up. And so the outward and the inward are exactly the same. Happen to be that in the middle case, the foot is significantly pronated, which is a great catch, Jane. On top of that, as I go up the chain, because the middle one is the most exaggerated, because her hips, she's not able to keep her strength in the left glutes that would stand her tall. And so the angle that is created on the hips and the pelvis, I'm going to make a quick drawing right here, is that her angle is like going downwards. It's not straight plane. And you want a straight plane. And I'm gonna move into another picture right here, as you will see, in clear difference in hip instability. So look at this angle and look at this angle. Relative angle right here. This angle is like where the injuries come in. So in her case, you see the left hip, it's just it's gonna create some form of capsular changes, and she probably is already in pain. And in her case, the earlier her case, she is upright, she's got the hip, knee, and foot in line, and it's fairly neutral. So great catch, Jane. And the other two is same thing. It's pronation. I don't see a whole lot of changes on the pelvis just yet, but we'll talk about it more. Hip, we talked about the hip. Then this is something probably a little bit more important for you, Jane, right here is the length, the problems with technique, lack of stiffness, not getting too tall. And I know that even we've done some running mechanics, running exams, is that we have a tendency to have buckle into the knee a little bit more. And so what that does is it puts a lot of strain on the knee and doesn't allow the foot mechanics, that rigid lever mechanics, to operate well, and kind of work on that in specifics. But that's one of the ways how the knee might develop. Same case in this gentleman's case right here. He's kind of leaning in too far with his motions. But signs of excessive pronation, we talked about. Supination, we talked about that. 10 laws of running issues. So we're going to go into one by one. Running injuries are not an act of God. These are all like facts, basically. In each injury progresses through 4 grades. There's pain after exercise. That's the first time, but then it goes away. The second is The second grade is like discomfort, but not yet pain during the exercise. The third is severe discomfort, now recognized as pain. So one is like after, then during, then before, and then boom, you can't even run. So these are the 4 ways it kind of progresses. So you want to catch it early. 10 laws of running injuries. Each injury indicates a breakdown. Most true running injuries are curable. Sophisticated methods are seldom needed to diagnose an injury. Just looking at the running mechanics itself does it. Like just an observer and a therapist, and just moving into what's the cause. You don't need like all these electrodes attached to the body, and all of that is good for research purposes and looking at what are the recognizable areas. But usually it doesn't require sophisticated methods. Treat the cause, not the effect. Look at the cause. This is what we dug into today, is cause, not the effect. Like don't just treat the pain. Yes, pain is coming. Where is it coming from? Why is it happening? And then complete rest is seldom the most appropriate treatment, which is most people do. Okay, it's hurting. Let me take a couple of days rest, come back to it, which is probably not going to work. Never accept as final the advice of a non-runner. Yeah, you can't go to a non-runner and ask, okay, what should I do? And well, I had never run before. Avoid surgery as a first line of defense. And there's little evidence that recreational running causes osteoarthritis. That's another some myth that people have, is like running causes arthritis in my knees. Well, that's not an actual fact. Injury prevention, an active warm-up, stretching, more important of those with deficiencies. Hold at least 30 seconds, avoid ballistic movements. So you want to have a warm-up. You want to do the stretches. You want to keep the running specific muscles strengthened. We're going to go into the running specific muscles. Choose running surfaces wisely. What surfaces are you going to run on? Avoid training errors. Not too many, not too cumbersome, not too fast, depending on what kind of program that you're running for. And be smart. Live to run another day. You don't want to, knock it out one day in the same day. Key lower extremity muscles to stretch. There are over 606 muscles, and these are the key groups that you want to hit: hamstrings, quads, hip rotators, flexors, groin, ITB, calf, and plantar fascia. And we've been doing series of these exercises, so catch us on one of these Facebook Lives and you'll get to learn more. But key lower extremity muscles to strengthen. Again, over 606 muscles. These are the specific ones that you go into for helping your runs: core strength, hip flexors, quads, hamstrings, glutes, calves, foot intrinsics, and general strengthening. Questions so far, guys? Questions so far? I know I went in too fast. And I don't want to take up too much of your time. I'm nearing very close to the 45 minutes. But what I have here is an offer for you guys. If you want me to dig into your personal running mechanics and finding out your pain, if you're suffering from pain and if you've got some issues going on, what we can do is we can do a pain and lifestyle audit. We can kind of define what's going on, how we can address, actually map out the future of the pain-free, how we see it progressing. We'll get the reports of the finding, what areas that we saw problems in, and then create a home program for you. Along with that, you get 24/7 access to Doctor Physical Therapy, live feedback on your movement form. So these are live one-on-one sessions, as well as real-time adjustment to your routines. And it's a $350 value product. And people who are currently watching right now, or ones who are on the recorded line, there are only 3 spots available, and we're offering that for just $49 for people who are watching. So questions that you have for me, please feel free to shoot that over to us. If you want to take advantage of the Telewell offer, you can reach out to us or on the Facebook, just kind of comment on it that I want to take advantage of that, and we can reach out to you. Or you can reach us. I know that people who are on the Facebook page, you are on my business page, so there is a contact information there that you can reach out to us. All right. Well, it's been great educating you guys. Thank you for allowing me to bring in knowledge and expertise into your world. And keep watching, keep following Dr. Saurabh Bhattan from Personalized Physical Therapy and Wellness. Have a great day.